Hi, Dr. Sullivan with Sullivan Dermatology. I wanted to show you a set of legs that I think are a little interesting. So this gentleman was in the hospital for several days for cellulitis, right? And if you look here, his leg is still red. And so I could easily imagine how somebody might think this is cellulitis or an infection. Redness can be a sign of infection. But the thing that's cluing me in that maybe something different is going on is if you look here, both of his legs are red. Now you may be a very unlucky person that gets cellulitis in both your legs at the same time, but that's pretty uncommon. So the fact that he has the redness tells me maybe something else is going on. So the other things I'm seeing are the change in the skin is something we call peau to orange, so French, like orange peel, right? And so if you look, you can see how it's bumpy. You can't tell in the video, but it's very firm, right? What this is something called lipodermatosclerosis, And this really tells us how the skin is a window into your body, because this skin change is telling me that this gentleman has a problem with his vascular supply. So he has something called venous insufficiency. And so I think this is one of the most amazing things about derm is sometimes these very superficial things that we just see on the skin that we don't think much of it can give us a big clue about other things that may be going on. So anyway, this is classic lipodermatosclerosis. It's a result of something called venous insufficiency, where the veins in your legs aren't working as well as they can be. And generally we treat it with compression stockings, and often we end up doing surgery for this.